I am Dr. Saubhik Sural, Clinical Director, Peerless, Department of Nephrology. Today I am going to talk about renal transplant. Now, kidney transplant is a process in which a kidney from another person is attached to the body and then it takes over the function of the diseased kidney. What happens in a chronic kidney disease patient when the kidney function gradually deteriorates to a level 10 to 15% of its normal capacity, then the patient has to be on some sort of renal replacement therapy to survive. Now, there are two types of renal replacement therapy. One is dialysis and another is kidney transplantation. Now, dialysis is definitely a very good procedure, but for the rest of the patient's life, he has to depend on a dialysis machine. Whereas in kidney transplant, the patient will be independent of a machine, so thereby there will be a much better quality of life. And in most of the time, we find that the patient survives for a longer time compared to a person who is undergoing dialysis. Now, the next question comes, from where do we get the kidney? The kidney comes from a donor which can be of two types. One may be living donor and another is the kidney is taken from a brain dead person, which is called cadaver renal transplant or deceased renal transplant. Like in our hospital, we did the last patient kidney transplantation, which was from a Nepal, and his nephew, he came for donating his kidney and the kidney transplantation was done successfully. Now, next question is that should we get some tests before we do a kidney transplant? Yes, there will be a series of tests which are being done to find out whether the patient is suitable and whether he can safely take a donated kidney. Now, at the time of surgery, what we do, we take out the kidney from the donor and we put it in the lower side of the abdomen, which may be either on the right side or on the left side. Now, what is being done is the artery of the patient and the vein of the patient, that is we call the vessels of the patient, which is being attached to the new kidney, and the tubes which we call ureter, they are being attached to the bladder of the patient. Now, once the kidney transplantation is being done, the patient is kept under a nephrologist in a unit which we call kidney transplant unit. Now, it is very important that the patient's condition should be monitored frequently and very, very carefully. Actually, what happens, because the new kidney is a foreign body, the system of the patient's body that tries to reject the kidney. So, we have to administer certain immunosuppressive medications which will prevent this rejection. Now, these immunosuppressive medications, they have got certain side effects. They are very important for the patient, but at the same time, they will make the patient prone to some infections. So, we have to give certain preventive medications which will prevent infection. We have to carefully monitor the drug level so that patient is not over immunosuppressed. This time, we also teach the patient and the relatives regarding the basics of immunosuppressive therapy so that even after being discharged from the hospital, they can closely monitor the effects and side effects of the immunosuppressive therapy. This is very important for a good quality of life. So, to sum up, what are the advantages of kidney transplantation over dialysis? Number one, it improves the sense of well-being. Number two, it gives you a better quality of life. Number three, most of the cases, the patient survives for a longer time compared to a dialysis patient. So, number four, the kidney transplantation patients will be free of a regular dialysis schedule. And number five, there will be a reduction or elimination from a diet restriction. So, basically, the patients can take a normal diet. So, kidney patients, kidney transplantation is definitely a very good option for you. Make sure that you are in the competent, safe and caring hands. Thank you.